In this video, we are going to discuss about the steps of tracheostomy tube suctioning. Articles for tracheostomy tube suctioning. An appropriate size suction catheter which is double the size of lumen of tracheostomy tube. Paper gloves, face mask, boiled and cooled water or normal saline, a clean and small glass, clean cloth pieces or sterile gauze pieces, small and clean towel, dustbin or paper bag to collect the waste, soap or hand rub for hand washing, a steel container with lid to store used suction catheter, and a portable suction machine with a connecting tube. These articles should be kept in a tray or table or a stool near the patient's bedside. Steps of tracheostomy tube suctioning are: first, assess the need for suctioning, like secretions in the tube or difficulty in breathing. Arrange all the articles near the patient's bedside. Place your feet on the pedal of the suction machine to check its functioning by assessing changes in the pressure while paddling. If using electrical suction machine, switch on the power button. Set a pressure of 50 to 80 mm Hg for neonates and about 100 to 120 mm Hg for children. Now wash your hands with soap and water. Apply enough soap to cover all the hand surfaces. Then perform the steps of hand washing. Firstly, palm to palm rubbing of hands, cleaning between fingers, cleaning the back of both hands, cleaning the base of the thumbs of both hands, cleaning the tips of the fingers and fingernails in a rotating and back and forth motion. Clean the wrist of both hands using rotating motion of fingers of the opposite hand. Then rinse your hands with tap water and turn the tap off with a cloth. Now let your hands dry. Wear face mask. Fill the glass with boiled and cooled water or use normal saline. Inform the patient regarding the procedure even when he or she is unconscious. Remove pillow from beneath the head end of the patient, if any, and provide flat position on the bed. Provide chest physiotherapy to the patient by making cupped hands as shown in the video, from outward to inward and downward to upward motion. Now spread the small towel across the patient's chest below the tracheostomy tube site or under the head and neck of the patient to protect the garments of the patient and the bedsheet from secretions. Attach the catheter to the connecting tube of suction machine carefully. Again, wash your hands with soap and water or use hand rub. Take enough hand rub to cover all the surfaces of both hands and perform all the steps of hand hygiene. Let your hands to dry. Now wear paper gloves. Spread the paper gloves on a flat surface. Avoid touching the gloves with your surroundings. Now, without touching outside, wear paper gloves one by one, first in your dominant hand and then in your non-dominant hand. Do not touch the surroundings after wearing gloves. Expose the patient's tracheostomy opening with your non-dominant hand or take help from another person. Make V-shape of the suction catheter or close the control valve. Now dip the suction tip in the water-filled glass or normal saline with your dominant hand and gently insert the catheter inside the tracheostomy opening until you feel obstruction. Then pull the catheter back a little and release the V-shape or close the control valve and withdraw the catheter in a rotating motion by holding it between your thumb and index finger. Make sure to clean the catheter between each suction attempt by dipping it into water or normal saline. Allow the patient to take 3 to 4 deep breaths in between. Repeat the suction attempt until all the secretions are removed. After the tracheostomy suctioning is done, dip the suction catheter inside the water or normal saline again and perform oral suction. Again flush the suction catheter in the water or normal saline. Wipe the mouth of the child with a gauze piece. Now clean the suction catheter with a sterile gauze piece or use a clean cloth piece. which is washed in an antiseptic solution and dried in sunlight. If you have used suction catheter for 24 hours, discard it in the dustbin. Disconnect the suction catheter from the connecting tube and keep the suction catheter inside the sterile steel container. After keeping the suction catheter inside the steel container, close the lid of the container. Now flush the connecting tube with water and keep the connecting tube on the suction machine and turn the switch off. Remove the small towel from the chest of the patient and discard the suction waste inside the closed drain. Remove your gloves and discard them in the dustbin. Now wash your hands with soap and water or use hand rub. Follow all the steps of hand hygiene. Here are a few points to remember. Repeat the procedure till there is no secretion and there should be no more than 2 to 3 suction attempts. Always do oral suctioning before nasal suctioning. Do not suction for more than 5 to 10 seconds during each suction attempt. Suctioning should be done 4-hourly or only as needed. Suctioning pressure should be adequate enough to effectively remove the secretions. It should not be too low that secretions can't be removed and not too high as to cause complications to the patient. Allow the patient to take 3 to 4 deep breaths in between each suction. Used suction catheter should be stored in a sterile steel container with lid, which needs to be sterilized daily. Reuse catheter for 24 hours only. Foot operated machine is preferred over electric suction machine as it is cheaper and does not require electricity to operate in home settings. Always cover the tracheostomy tube with a layer of sterile gauze piece. Do not use the same suction catheter for tracheostomy after suctioning nose or mouth. Do not use substances that can irritate the airway like powders or hairsprays. Exposure to environment or second-hand smoking should be completely avoided.